well, in case I'm not clear with something I'm explaining. So anyway, I'm a family nurse practitioner. I work at a primary care office. So we see kids all the way, every age group. We see them for all kinds of primary care stuff. And I'm going to show you some examples of things that I see every day and what kind of ages and what things I do. But I also, that's actually my part-time job. My full-time job is I am a professor or faculty in a nurse practitioner program. So I teach in a master's program. So it's people that are already working as nurses and are getting their master's to become nurse practitioners. And that's my full-time job. So I write lectures, I grade assignments, I write assignments, I do admissions. Today I was working on reading applications for people who are trying to enter the program. So that's my full-time job. When you teach in a nurse practitioner program, there's a requirement that you work in the field, that you work as a nurse practitioner seeing patients 1 day a week to stay current and to stay active in the profession. So I kind of have a spin of both, and I'll kind of talk through them as I go. The main thing I want to talk about, as you see, is the profession of nursing. Nursing has changed and grown so much since I've even been a nurse. I've been a nurse for about almost 20 years. And so even since then, the profession has changed and grown and developed in such amazing ways. And I think for a lot of people, especially students looking at going into nursing, it can be really confusing. What are the different degrees? What are the different ways I can go? What are the different jobs I can do? And so I kind of want to spend a little time talking through the different jobs that you can have as a nurse, either with all different degrees we're going to talk through. So anyway, that's the way we're going to head. And then I'm going to talk a little bit more about my job as a nurse practitioner. I've always known that I wanted to go into the healthcare field. The human body is fascinating to me. And even as a young child, I can remember just being fascinated by how your body works and how it heals and how you grow and change. And so I knew that's what I wanted to do. I looked into a lot of different healthcare professions as I was trying to decide what to do. I love sports, so I thought about doing athletic training, but really was turned away by the time commitment of the job and when you work. It's very difficult work hours. You work when there's games and when there's practices, and it's not super family friendly and can be difficult. And so that kind of steered me away from athletic training. I thought about physical therapy as another option and still think that's a fascinating job, but wanted to know more about the science and the inner workings of the human body. And so that's what led me to nursing. So I want to start off by sharing a few really interesting facts about the body, because I think, like I said, it's so fascinating to me, and I think these are really fun. So your body produces 25 million new cells each second. That's amazing to me. So if you think about, I've already talked for 4 minutes. So that's a lot of millions of cells my body has already produced. And some of you have probably already studied the human body and the cell, at least, to know about the nucleus and the ribosomes and blah, 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 all the different things. So think about the fact that your body has made 25 million of those. That's crazy to me, and so fascinating. Next is a red blood cell can travel through the entire body in 20 seconds. So if you think about going from the heart out to the body to the peripheral area, it does a lot of gas exchange. It comes back, it comes all the way through the body and back to the heart in 20 seconds. So it did it faster than I explained it. The next one's about nerve impulses. They travel 249 miles an hour. So if you think about your finger, you touch something hot, that nerve impulse has to travel up your arm, into your brain, and then go back and then send an impulse back for you to get off of that hot item. So if you think about how fast that actually happens, but all the things that have to happen in your body in that 1 second for you to pull your hand away from the hot thing. The next one is the surface area of the lung. So think about your lungs right here, right? You're exchanging a lot of gases. A lot of things are happening in those lungs. But if you took it open and spread all those little alveoli and all those little areas in the lungs and spread it out, it would cover one side of a tennis court. So that's just you. So think about this little area right here spread out. And if you can picture a tennis court, that's fascinating. So next, Every square inch of the human body has an average of 32 million bacteria. So hopefully you don't have any germaphobes in the group, but think about all those bacteria. Now, bacteria has a purpose in your body. You have a lot of bacteria in your gut. You have a lot of bacteria in your mouth. You have a lot of bacteria everywhere. The bacteria in your gut especially is super important. You need that bacteria. It helps you digest. It helps you maintain healthy lifestyles. Some of that bacteria eats or destroys bad bacteria, and on and on. So yeah, it's a lot of bacteria, but it's there for a reason. And then think of all the mechanisms your body has that protects you against that bacteria. Things like snot, tears, saliva, your skin, on and on and on, just protects you from that bacteria entering your body and making you sick. A human blood vessel is so long that it could circle the globe 2.5 times. That's crazy, right? That's in your body. Now, this is an adult, obviously, and most of you are probably adult size, but that's crazy. That's so long. And then this is the last one, but the liver performs 500 different functions. So if you think about the liver is maybe a little bit bigger than kind of your hand. It's right on the right side of your body, kind of at the bottom of your ribs on the right side. If you have a healthy liver, you can't feel it because it's kind of up under those ribs there. Your ribs are there to protect your liver because it's so important. But it's there and it does 500 different functions. That one organ of your body, that one thing does 500 different things. It helps you clot, helps your blood clot. It obviously helps filter out. So filters all the gunk out, things that your body doesn't need. Those are 2 functions that are incredibly important for you to live. And think of the 500 different things that the liver does. That's crazy. It helps make insulin for you to metabolize sugar. And I'm going to stop there because I can't list all 500, obviously. But anyway, those are just some facts that I thought were really fascinating and why I am just so fascinated with the human body. I have now been in college 7.5 years, and I'll talk about that in a little bit. And I'm still learning new things about the human body. And we're still, as scientists, we are, as nurses, scientists, studying the human body and understanding new things every day, a new chemical in the body, a new way it works, a new medication to help treat things. I mean, how long have we studied the human body and we're still learning so much, and that's incredible. So I want to talk first about the different areas of nursing before I get into myself as a nurse practitioner. But there's different degrees you can get. First is an associate's degree. That's a 2-year degree. And I'm going to talk in a minute about the different jobs that you'd have with each one. Then a bachelor's degree. And that's what I did. I went straight from college to a normal 4-year, not a normal, but a 4-year college, and went straight to get a bachelor's degree of nursing. Then there's a master's degree, and those are considered advanced practice nurses. And then there's also a doctorate. So I got my bachelor's almost 20 years ago and worked as a nurse. I worked as an RN or a BSN. So I had my bachelor's, which is a BSN, and I worked as a registered nurse. I worked in a lot of different areas. So I worked in a pediatric ICU. I worked in an emergency department in many different states. I did those 2 main things. And I worked all different hours. And I'm going to talk about those here in a second. And then I went back to college and I got my master's degree at University of Cincinnati. And that's when I became a nurse practitioner. Now I'm getting my doctorate. So I'm actually at ECU right now. I'm almost halfway done with my doctorate degree. I'm getting my doctorate degree because I'm in education. So I'm learning some of those details and some of those things that are really going to benefit me as a nurse educator. So let's talk about each of those specifically real quick. So the associate's degree, that's the 2-year degree in this area. Wake Tech has a great program. Durham Tech has a program. A lot of the technical schools have those associate degrees, and it's called an ADN. Once you graduate with that, you take what we call the NCLEX test, NCLEX. That's a test to make you a registered nurse. That's a test that everyone in the country takes. And it's saying, okay, you know the basics that you need to be a safe nurse. And you take that after graduation. And then once you have that, you're an RN and you can work. They work all over the place. So they can work in nursing homes, they can work in hospitals, they work in outpatient offices. So a doctor's office or examples like that. They do home health. And in no way is this an inclusive list. There's a lot of things that I'm not even including. And that is the beauty of nursing. And one thing I tell everyone about nursing, the different jobs that you can get are vast, and they're so different. There's nursing jobs where you don't touch patients. You might work in nursing informatics. You may do nursing leadership, we're going to talk about in a minute. Or there's jobs where all you do is work with patients, and there's a wide variety of patients you can work with. You can work with just peds, just pediatric patients. You can just work with geriatric patients. You can work with healthy patients preventing disease. You can work with the really sick and do hospice care and helping patients at that hardest time of life. And so no matter who you are, what your skills are, what your love is, and what your interests are, there's a job out there for you. And that's the beauty of the nursing profession. So that's one of the main things that where you see an ADN work. The one thing I will say is they are working on trying to phase out the ADNs a little bit. There's still a place for them, but a lot of hospitals now, once you work for them a little bit, they require you to get a bachelor's degree. And I'm going to talk about why here in a minute, but I know I worked for Wake Med, and they did really strongly. We're encouraging everyone to go back and get their bachelor's degree to be working there at that point. So there's still a lot of jobs available for ADNs, but it's become a little bit more restrictive of where you work or that requirement to then get your bachelor's at some point. So let's talk about that bachelor's degree. It's a 4-year degree. You can get it. A lot of schools have it. Around here, almost all of them have it except for NC State. They don't have a nursing program, but almost every other big school in the state has them. I went to a small Christian school in Ohio called Cedarville University, and they had a great nursing program. And you graduate just with a bachelor's degree. So I took a lot of gen eds. I took my histories. I took my English. I took my speech. All those kind of things. I took a lot of sciences. So I took chemistry, biochemistry, obviously anatomy and physiology, a lot of foundational sciences. And then the last 2 years of my degree was learning nursing. It was nursing specific. So I learned how to do procedures, putting in IVs, putting in Foley catheters, how to calculate medications, how to administer medications, things like that. And then because I had a bachelor's degree, I learned we had some extra classes that you don't have when you get that associate degree. So I learned about how to read and interpret research. I learned about leadership skills, how to be a leader as a nurse. I learned about nursing theory and the nursing profession, the history of nursing, things like that as the nursing profession grows and develops, they feel is really important. Our requirements as nurses has grown and grown and grown. And I will tell you, as a nurse in the pediatric ICU, my job was very technical. I was constantly using math and science. I was reading research, and I was working to apply that research. And so those skills that I learned with my bachelor's degree, I used all the time. And that's why they're working on encouraging more and more that the jobs are it's a bachelor prepared nurse for those positions. So I worked in a hospital, and like I said, hospital nursing can look very different. Even when I worked in the emergency department versus the pediatric ICU, my days were very different. As far as hours that you work, that depends on your job, right? If you're in an outpatient hospital, doctor's office, you're going to work 9 to 5, Monday through Friday, but the pay is not as good. If you work in a hospital, you're going to work a lot of different hours. A lot of them are 3 12-hour shifts, which is amazing, by the way, because you work 3 days a week and have the other days off. They're big, long days, and you're really tired a lot of those times, but it's nice for that. When I had small children, I worked nights and weekends, which was amazing for my husband and I because we were home taking care of our kids, but I was able to work and I was able to grow my career. And I feel really lucky to be able to be with my kids a lot, but also have to continue to develop and grow in my career during that time. So that's hospital-based nursing, nursing homes. And I actually worked in a nursing home as a nurse's aide when I was getting my bachelor's degree. So when I was home on weekends or when I was home for Christmas and home for the summers, I worked at a nursing home as a nurse's aide and helped take care of patients. outpatient offices, we talked about home health, clinical research associate. So if you really love research, you can do that as a BSN. The military, and I say that because my brother-in-law's an Air Force nurse, so he got his bachelor's doing a ROTC program and now works in military hospitals and does those things for the military. And then nursing leadership, as I talked about. A lot of areas now want you to do, if you are the head of a nursing unit or leading in any way, they may require a master's at some point, but it depends on the hospital system and what's happening with that job. So let's keep going a little bit. So next is the master's degree. This has grown exponentially as far as what types of degrees there are and what's available to you. So one of the main things that you can get a master's in, an MSN, Master's of Science of Nursing, is an APRN, which stands for Advanced Practice Registered Nurse. So I am still a registered nurse. I have an RN license in the state of North Carolina, but I also have an APRN license. I have both, and that APRN is to be a nurse practitioner. Okay, so there's different areas that you can do as an APRN. You can be a nurse anesthetist. So those are the people that help people go to sleep for surgery. You can do that in a hospital. You can do it in outpatient. Some might work for a dentist, right, to put people to sleep for that. There's so many areas that you can work with that. Then there's the nurse practitioner, which I talked about. I'm a family nurse practitioner, so I can take care of any age, and I specialize in outpatient preventative primary care medicine. Okay, there's a typo there. So pediatrics, you could be a pediatric nurse practitioner. You can be acute care nurse practitioner. Those are the ones that work in the emergency department or that work in an intensive care unit in the hospital. You can be a mental health nurse practitioner, and that's huge. Mental health there's a big gap in it. We don't have enough mental health providers. And so there's all kinds of jobs as mental health primary care or mental health nurse practitioners. Other things you can do in an MSN is you can do nursing education. And that's what I'm doing, right? I'm doing a little bit of both. I have one foot in each door, I messed up, but that, I'm doing both. Hospital administration I talked about, and you can get a degree in nursing leadership to do that hospital administration. Research, you can do more research. Nursing informatics, there's degrees in a master's degree in nursing informatics. Healthcare policy, establishing all the healthcare policy. They need specialists and they need good people for that job. Population health, so that's looking at the population as a whole. And I just wrote a paper on this actually, where I did an evaluation of Wake County, and I had to look at the health overall of Wake County. Overall, well, Wake County is a very healthy county, but I looked at a evaluation where they broke Wake County into chunks, right? So they looked at Cary, Holly Springs, Apex. They looked at North Raleigh. They looked at downtown Raleigh. They looked at South Raleigh, which is like Fuquay, Varina, that kind of thing. And then they looked at East Raleigh. And the vast difference in health, in income, in access to healthcare was hugely different. And so as a county, our goal, okay, we're doing great in parts of the county, but wow, they have a ton of primary care physicians, but over here, they don't have any primary care physicians, or they don't take Medicare, Medicaid, which is a huge barrier for these patients to get the healthcare they need. So working with population health is looking at things like that. What do we need to do to have more primary care providers in that area, that kind of thing. And then forensic nurse consultant is another job. And I know that's very interesting to a lot of people. So I wanted to mention that. And there's degrees that you can get in that. And then the last is the doctorate degree. And that is, I am going to have a DNP, which is the second one. You can either get a PhD or a DNP. And here's the difference. PhDs learn how to do research. You are in the field, the research field, you're doing research, you're learning those intricacies of how to do research. DNPs take that research and translate it to practice. There is a 17-year gap between when research is done and when it actually gets and translates to patient care. That's huge, right? 17 years is a long time. So they may over here in research find, wow, we think we found this new medicine to care for diabetics, and it's going to be amazing. But then the medicine has to be developed, and then it has to be researched, and then it has to go through this and this and this. So all of that takes 17 years before that medication is readily used for diabetics. A DMP's goal is to speed that process up. So we learn how to read research. I learn how to interpret research. I learn how to know if it's good research or bad research, because there's definitely a lot of research that's not done well and it's not good science. So I learned how to interpret that and then translate that into practice and use it in my practice. And then another thing that's for both of them is nursing education. PhDs are good, or DMPs can do that. So that's all the degrees. Hopefully that was helpful to kind of see where you want to go and what might interest you if nursing is something that interests you through the field. So next I want to talk specifically about family nurse practitioners, since that's what I do. I take care of patients of all ages. I learn in my master's program. In my bachelor's program, I learned about the disease processes. I learned about the medications used. I learned about all the different things on caring for that. But the doctors and nurse practitioners and providers were the ones that determined which care we were going to do, which medications we were going to give, that kind of thing. So in my master's program, I learned that information, how to diagnose, how to treat, what medications can be used, that kind of thing. And I focus a lot on preventative care, and we're going to talk about that in a minute. So I wanted to spend 1 minute talking about what's the difference between a nurse practitioner and a physician's assistant. So you may have heard of both of them, but not really understand what the difference is. And so both of them have master's degrees. They're taught from a different perspective. Nurse practitioners are taught from a nursing perspective, where physician's assistants are taught from a physician's perspective. They can do very similar jobs. And a lot of them, if you look at a job posting, they'll say hiring a nurse practitioner or physician's assistant. And so they're trained differently, but trained to do the same thing. One thing that is different, and this depends on the state. Okay, and you've probably learned some laws are national laws, some laws are state laws. The regulation of nurses and physicians physician's assistants and medical things is a state regulated thing. So each state determines their regulations for that. So I have a North Carolina nursing license and a North Carolina nurse practitioner license. When I need to do things, I deal with the North Carolina Board of Nursing. Physician's assistants work with the North Carolina Medical Association doctors to get their MD, do the same thing. Okay, so each state has a little bit of different regulations. One thing that's interesting about nurse practitioners is it's a fairly new profession. Okay, if you think about teachers, there was teachers in the 1400s. There's always been teachers, right? There's always been some form of physician. That's changed a lot, but it's some form of physician. There's always been a lot of different professions have always been around. Nurse practitioner, that job started in the mid 1900s, and it started because there was not enough primary care physicians. There was patients out there that needed to see a doctor, and either the doctor was an hour away or the local doctor was full and didn't have availability. There was just a lack of availability of people to take care of them. And so some nurses said, we're going to get some more training. We're going to learn a little bit more, and we're going to be able to fill in that gap and help these patients get the care they need, to see a provider and to take care of them. And so that started in about the 1900s. It's developed a ton since then. And the master's degree, it's continuously developing. But because of that, the regulations are a little bit different in each state. In some states, nurse practitioners have to work with a physician. In some states, nurse practitioners can work independently. So they can actually own their own practice. They can see patients independently. And that varies from state to state. Now, physician's assistants always work under a physician. All 50 states, that's the same everywhere. NPs may be different. So that's one area that we're a little bit different. But a lot of it's pretty similar in what we do. Okay, so I wanted to talk a few minutes about what my everyday looks like. What do I do? What kind of things? Some things I do are procedures. Now, I didn't have pictures of myself doing procedures, but this is from where I teach, the school that I teach, and these are some of my students learning how to do procedures. So I thought I'd include some of these pictures to show you what my students were doing. So if you look in the picture in the bottom left-hand corner, this is one of my students learning how to look into an ear and determine if it is otitis media, or also, which is an ear infection, okay? So she's in there, and this is actually takes a little bit of skill to look in there, and you can see the eardrum, and you can see, is the eardrum flat? Is it pearly gray? Can I see the light reflecting on it? That's a normal eardrum. Or is it super swollen? Is there pus behind it? Is it bright red? That's an infection. So that's a skill that my students learn how to do so that they can diagnose, and then they learn how to treat. When do I give an antibiotic? Which antibiotic do I give? What dose of antibiotic do I give? How long do they take that antibiotic? Ooh, what if they're allergic to that antibiotic? What other antibiotic I give? So it's a lot of things that you learn, and that's a simple diagnosis that we deal with all the time, but something that they're learning. So if you look up in that top left picture, that's actually a pig foot. We use a lot of pig's feet for education because, at least in my school, because the skin is very similar to our skin. So if we look working on sutures, which we're going to look at that picture in a minute, and they have toenails. So what she's doing right here is what we call trephination. And she has this tool right here, actually is cautery, or it burns. And sometimes people will come into the emergency room, or, you know, and they've dropped a brick on their finger, or shut their finger in the car door or something, and they get blood collection actually under the fingernail. It's very painful. And so what we do is we actually burn a tiny hole in that fingernail, and it allows the blood to come out, and it immediately relieves their pain. And in a lot of instances, it can help prevent the fingernail from falling off in the long run. So this is called a trephination tool, and she's practicing that, burning that little hole in that fingernail. Now, pigs' toenails are a little thicker than ours, so it's not a perfect example, but that's what she's doing there. In this middle picture, she's doing something we call incision and drainage. We call it INDs. And people come in with cysts or abscesses that are infected, and it's kind of a pocket of infection under your skin. And if we don't let out that infection and let that out, then they can get really sick. And so we actually have to open that area up. So she's actually opening up, and this is a cyst. This is a fake kind of a model of skin with a cyst in it, but you can see she used this scalpel right there, that blue tool, and she made an incision, and she's pulling out the cyst there so that it can heal. Here is just a little pig's foot that they were practicing sutures on. So you can see some of the extra suture material, and then some of the suturing that she did. And that's something that I do in practice. If someone comes in with a laceration, I'll suture it up. And this bottom right picture is kind of gross, but one thing that we do is looking for bad moles or different things, and we'll biopsy of them. So this student here was practicing taking off some moles for biopsy, or cutting out an area of the skin that was concerning to us so that we could send it for a biopsy. So those are some of the procedures that I do. The next thing I do is look at x-rays. So I thought these were really interesting and wanted to share some of these x-rays. The bottom left-hand corner x-ray is, of course, of the chest. So you can see the lung fields. You can see the ribs, which is those vertical lines. I'm not sure if you can see my cursor when I move it over, but the kind of two semicircles at the bottom is your diaphragm. Below on what you're looking at is the left side, or the patient's right side is the liver that we talked about. The white is an organ or bone. The black is air. So that's why you can see those lungs, they're breathing in air, and that's why it's dark where the lungs are. And you should see dark where the lungs are. If you look in the bottom right-hand side of the picture, which is the patient's left-hand side, there's kind of like a little semicircle of black. That's actually their stomach, and that's a little air bubble, like a little gastric bubble in their stomach. So when we eat, we all swallow air, and that is a little bubble there. But right above that is kind of a white area, and that's the heart right there. And so you can see kind of that cardiac silhouette there. And all of these things we look at and evaluate. There's a lot of things we look at. What is the size of the heart? Where's the heart positioned? Because there's something called dextrocardia, where the heart's on the wrong side of the body, or cardiomyopathy or congestive heart failure. The heart gets really big. So you'll look at a picture and the heart is actually huge. It takes up way more space than it should, which is not a good thing. That little white, how do I explain that? It's kind of a little webbing on the side. That is actually vascular. You can see it's vessels where the blood is going to do gas exchange there. If you look on the very outside of the rib, so kind of where the vertical lines go to the outside, this patient's starting to develop a little bit of pneumonia. And I can see that for a lot of different reasons, but there's a little down in the corner. There's not a good line down there. So that's what we were looking at and evaluating in this patient. Okay, so let's move to the next one. This is it's called a KUB, which is an abdominal x-ray. So you can see the ribs, you can see the liver actually in the top left-hand side there. You can see the spinal cord that comes down. There's some of these weird little buttons. Those are actually buttons that were in her jeans that you could see in this picture. Those are her hips on the bottom part. We're going to look at another KUB here in a second. But what we were evaluating is this patient had really bad abdominal pain. So we did a basic x-ray, which is a very basic test that we do for the abdomen. But if you see the kind of little darker blobs there, and there's some a lot on the left-hand side of the picture or the patient's right-hand side, there's some kind of over on the left-hand side, and there's a lot down in her hip bone. That's actually stool. This patient had abdominal pain because she was really constipated. And so that's what you can see in that picture. And if you look at that next one, the one that's a little more white, this one is actually also constipated, and this patient is very constipated. So all those little dark blobs, that is the gastric or your intestines kind of dilated because there's so much stool in her intestines. So you can see that. This is a really good, you can see the liver silhouette. So on the picture, as you're looking at it, the left-hand side, kind of the top, and it's, what shape would that be? It kind of is triangular maybe a little bit, and that's her liver there that you can see. You can see her hip bones really good, and then her femurs coming out. Femurs are a ball and socket joint. So there's kind of the socket that it's in and then the ball, and that's why your leg can bend in all those different directions. And you can see that really clearly in that picture. There's like a little ball, and it fits in that socket that goes down to the femur or the leg bone. So that's really cool there. The foot, the next picture is a picture of a foot. And this one has a little fracture. So these are the metatarsal, or the 5 main, and there's a lot of bones in your foot. So this is kind of the bottom would be the ankle, and the top would be the end of the toes. You can't see the end of the toes, unfortunately, in the picture. But you can see on that 5th metatarsal, this is her right foot, I think this was a woman, the outside of her right foot, there's that little break in the bone, and she had a fracture of her 5th metatarsal bone right there. The last one, I apologize, you can't see it super well, but these are bilateral knee x-rays. You can see the knee. The knee is a hinge joint, so it works like this instead of the ball and socket like this. Okay, so the knee should sit like this. The knee bones should be a little bit separated. Okay, there's a lot of padding, meniscus, ligaments, all kinds of things in there, and you want that there. A nice, healthy, young kid, there. And if you look at those x-rays on the knee that's on the left side, which is the patient's right knee, the inside or the medial side, there's a nice space there. You can see kind of a dark line between both leg bones. But if you look on the right-hand side, as you're looking at it, the left-hand side, it's bone on bone. Those bones are actually touching. That's arthritis. Okay, so this patient actually has really well-developed arthritis and probably a lot of knee pain, which is why we got those x-rays. She has a little bit on the outside of both knees. You can see that there's not good spacing there in that. So hopefully those were a little bit interesting for you, but that's x-rays. So the next thing I do is diagnose and treat. And this is different every day. Every day, and I love that, right? Every day, I don't know what I'm going to see. I don't know what my day is going to look like, what I'm going to talk about, what I'm going to look up, what I'm going to research, what I'm going to chat with patients about. And so yesterday I worked and I saw patients. Our office is open from 7:30 to 6 p.m. So I do that one day a week. I go see patients. And so as I was seeing patients, I just wrote down the different types of patients that I saw yesterday. And so this is the list. So I saw a diabetic, I saw an ear infection, I saw a rash, I saw someone with pancreatitis. So your pancreas is kind of right in the middle of your gut. And it does a lot of different functions for digestion, and hers was infected. Hyperlipidemia, so that's high cholesterol. Lipids is fat, so that is that name there. I see a lot of depression and anxiety, so I saw that. Hypertension, which is high blood pressure. I saw COVID and flu. It was COVID negative, but I did do a COVID test from someone who had flu-like symptoms. I saw abdominal pain. I did a sports physical for someone about to start a sport. I saw back pain. I saw someone with dizziness, and this was a 77-year-old woman who we just started a new medication on for depression, and she came back in with a lot of dizziness and dry mouth, and we determined it was probably just side effects from the medication. And that's the problem with science. We treat, but everything comes with side effects. So I see a lot of orthopedic injuries, and then I see a lot of allergies, and I see allergic reactions, bad ones. I have a runny nose. I have watery eyes. I see a lot of that. We do allergy testing, so skin prick testing, where we test different things, lots of things with allergies. So that's my day. The last thing I want to end it with is a little talk about preventative medicine. And this is a huge focus of nurse practitioners, especially family nurse practitioners, is preventing disease. What can we do? That's the easiest way to keep someone healthy, right? Rather than find the illness and treat it, why can't we prevent that illness and prevent someone from getting sick? It's huge cost savings for our economy, for the person, but also for our economy as a whole. And very beneficial. So there's 3 different types of preventative medicine. One is preventing the disease itself. We don't want them to get sick. Number 2 is screening to find it early. And we're going to talk about some examples of some of these here in a second. And number 3 is treating it to prevent morbidity and mortality. So morbidity is mortality is dying from the disease, right? So someone has a heart attack and they die from heart disease. Morbidity is having a lower quality of life. So a diabetic that maybe has to get their toes amputated has morbidity, or their blood sugars are so unstable they can't work. They have a lot of morbidity from that disease of diabetes. An asthmatic who has such bad asthma attacks that she can't exercise, that's morbidity from the asthma attack. So those are just kind of the effects of the disease itself. So we're treating, someone who's diagnosed with diabetes, we're doing everything we can to prevent morbidity and mortality. We want them to be a diabetic who's able to do everything they want to do, who can work, who can run, who can do everything and have a healthy life, long life, even with diabetes. Okay, so let's talk about some examples, and then I might come back to this slide in a second. So the first thing I wanted to talk about is chronic disease. 7 out of 10 deaths are due to chronic disease. That's a lot. So if we can prevent chronic disease, that's huge. And I talk to my patients all the time about healthy lifestyle, exercising to prevent heart disease, exercising to prevent diabetes, keeping your weight healthy to prevent all those diseases, right? Not smoking to prevent COPD and emphysema. The list goes on and on and on of things that we do to have a healthy lifestyle to prevent chronic disease, because it's such a burden on the patient and on our population as a whole. 7.2 million Americans have undiagnosed diabetes. Undiagnosed. And there's millions and millions, and I should have looked up the number of who are diagnosed, but this is a lot of people out there that have diabetes. Now, when you have diabetes that's not treating, there's a lot happening in your body. And the way I explain it to my patients is diabetes damages the small blood vessels in your body. When your blood sugar is too high, there's damage happening. So those are the small blood vessels around the heart and in the brain, which makes you higher risk for heart attack and stroke. The small blood vessels around the kidney, which a lot of diabetics have kidney disease and their kidneys fail. The small blood vessels in the eyes, which can lead to blindness. The small blood vessels in the feet, which can lead to something called diabetic neuropathy, which is basically your feet hurting all the time, or diabetic gangrene, so they can get infections and not know, and that's why we have a lot of amputations with diabetes. So anyway, when we're not treating them, when we're not controlling their blood sugar, all these things are happening in their body, and their morbidity and mortality from diabetes is just climbing and climbing and climbing. If we can diagnose these patients and treat these patients, we can really bring down their blood sugar and prevent that morbidity and mortality that they're going to face. Approximately 60 million Americans have high cholesterol levels, which is a significant risk factor for heart disease. And you may have heard of cholesterol, that's just fatty content in the blood. LDL, which is bad cholesterol, builds up in the body, and that's where you have strokes, heart attacks. The list goes on and on of the things that we get from that. And every day, 2,300 Americans die from heart disease. That's one person every 38 seconds. So I've been talking for about 40 minutes. So think of all those people that have died from heart disease, and a lot of that is preventable. One, through healthy diet and exercise, we know that. But we have medications that can lower cholesterol. And if we can screen for it, which is the second area of preventative medicine, I'm going to go back and talk about that in a second. If we can use that medication to bring those cholesterol levels down, these numbers are going to go down significantly. And then I talked about the first type is preventing disease. Vaccinations save the lives of roughly 42,000 children each year. So this is a statistic from the CDC, or the Centers for Disease Control. 42,000 kids each year, their lives are saved because of vaccination. That's fascinating to me. But if you think about all those shots when you got as a little kid, some of you might be in high school or in middle school and just got some vaccinations. We talk about the COVID vaccine, of course, the flu vaccine we talk about all the time. 42,000 people, that's huge, are saved every year from those vaccinations, and such a powerful statistic. And then a lot of the screening that I do, a lot of the preventative medicine is screening for cancers. So that's through mammograms, pap smears, colonoscopies. For patients that have a history of smoking, we do screening for lung cancers. And if we find it early, we can treat it, right? If we don't find it till late in the disease, we can't treat it. But finding breast cancer early can reduce the risk of dying from the disease by at least 25 to 30%. That's a lot, 1 in 4, right? If we find it early, we can prevent death. We can save lives from doing these mammograms. So let me go back really quick. Oh, let me see if I can go back on this. Let me see. Oh, here we go. So real quick, and then we'll be done. But if you talk about preventing the disease, so those are vaccinations, that's healthy lifestyle, things that can just prevent us from getting sick in the first place. Screening to find it early. So I talked about that, where we do mammograms and pap smears and x-rays and things like that to find disease early so we can treat it before it gets bad. The same with diabetes. If we can find it when they're pre-diabetic and either help them change their lifestyle to reverse the diabetes, or treat it to keep that blood sugar low. Same with cholesterol. If we can find really early when someone's 40 that their cholesterol is high and help them treat it and bring it down, we're going to reduce the outcomes, the poor outcomes, if we did not. And then last is treating. So they have the disease and we prevent morbidity and mortality by treating it and caring for it properly. So that's all I have for you. Hopefully that was interesting. But I know y'all have some questions. So if you want to fire away, I'll see if I know the answers.
I have a couple questions I was going to ask that we have gotten through forms we sent out before. I can ask those. Our first one is, what are the best and most difficult parts of your job?
Sure. The best is treating someone and having them feel so much better. I had a woman who had been struggling with depression, and she said, I've struggled with my whole life. I've really worked through it. I've done counseling. I've worked on my lifestyle to be healthy, because exercise is huge for depression and anxiety treatment. And I'm just to the point where I can't handle it anymore. So we talked a lot. We talked about healthy things she can do with her lifestyle. We talked about getting back into counseling, and I started a medication that's used to treat depression. I saw her 1 month later, and she was crying, "You saved my life," which I didn't. I just did what was prescribed, right, for this disease process. But being able to talk to her in a way that, first of all, doesn't degrade her. A lot of diseases, for instance, obesity, depression, anxiety, the patient's embarrassed to come talk to me about it. They're ashamed that they're overweight or that they have depression, anxiety. So talking to them in a way that helps them understand this is a disease process. Okay, this is this isn't on you. Like, we can work on this, and this is okay that you're here, and that I'm so thankful that you came to talk to me about this. And what can we do to get it better? So when I see patients who lose weight and reverse their type 2 diabetes, or a patient who is better because of the work I did, that's one of the best. Now, when I was a nurse and I worked in the hospital, I would take care of really, really, really sick people, people where I would do CPR all the time in the hospital. I actually, hopefully this isn't too much, but we used to take care of kids, babies that had heart surgery. And when they would come back, they actually came back with their sternum kind of open because there's a lot of swelling. And if they would have closed it, the swelling would have gotten so bad that their heart wouldn't work properly. And so I've actually done CPR where I actually squeezed, a baby's heart. So like, I hope that's not too much for anybody, but I saved lives. That was the best thing, is helping people better their lives through what I do. The worst thing, some things that can get monotonous about my job are kind of saying the same things over and over again. I tell people all the time about living healthy lifestyles. And as Americans, we do not overall have healthy lifestyles. They don't exercise. They don't eat healthy. And it's just a lot of over and over again saying the same things, which can be frustrating.
Thank you so much. I never realized how much the medical field deals with mental health.
Yeah, it's huge. I tell people all the time, there's some days where almost half of the patients I see are there for anxiety and depression. So it's huge. And I think COVID has made it worse. So I've definitely seen a lot more in the last year, but I see it a lot.
Yeah, this next question also kind of ties in with mental health, but more of your own mental health. Like, how do you balance family and work life and just like taking care of yourself?
Yeah, of course. I love sports and being active. So for me, putting aside time every day to stay active, to exercise in some form, it may be yoga that day, maybe going for a walk. For instance, the days that I work, it's a long day and I come home and I haven't seen my family all day. And so I want to spend time with them. And so what I actually started doing about a year ago is I do get a lunch break. I eat really fast and then I go for a walk, and the office is near a neighborhood. And so I put aside 40 minutes of my lunch break and I put in a podcast and I go for a walk during my work day. And that's made a huge difference in me getting home and feeling like, okay, I've taken care of my body, I've taken care of my patients, and now I'm ready to take care of my family and be here with my family and enjoy my family. So that's one thing. I think when I worked in pediatric ICU, I took care of a lot of hard cases. And so allowing yourself to heal and learning, and that's one thing we learned in nursing school, is how to care for yourself emotionally as you care for other people and their emotions. And I think learning those skills, allowing yourselves to grieve with patients and to work with patients, I think is really important. Setting aside time for yourself during that time. So every Monday night after we get the kids to bed, I do something for myself, because those are my really long days. So I read a book or I watch a movie, or, it's just something that's just letting my brain rest, if that makes sense, are some of the things that I do.
Yeah, that's really great. And I've seen a lot of things about how just walking even 10 minutes a day can really improve.
That's what I tell my patients all the time, because I think sometimes they think, exercise, what's that, like a 40-minute run? Most people don't enjoy a 40-minute run. And that is not what exercise is, honestly. It's getting your heart rate up, working so you're breathing a little bit heavier. So that's when you get the cardiovascular benefit, but finding something you like. Find something you like and do it, and make it a habit. Do it with somebody, do it by yourself, whatever you like better. And so I tell people it doesn't have to be miserable. It can be enjoyable, and it's really important.
Yeah, even a little can go a long way. Thank you so much. Our next question is, how would you recommend getting an early start to being in your field? Like, what are some extracurriculars, classes, etc., that you think are really beneficial?
Good. Yeah. So sciences, in high school, when you can take sciences, is really beneficial. I did some shadowing. So I found a nurse practitioner or a nurse that I could shadow with. Sometimes that's a little harder just because of HIPAA, which is a Patient Privacy Act. You have to be careful with that. But I also set myself up to work as a nurse's aide, like I talked about when I was getting my bachelor's. And that was really helpful for me to get that experience doing kind of the basics of nursing care, where I helped dress people and get them ready. And I I'm not doing that obviously for my part of this job, but it taught me a lot about compassion and that kind of thing. So taking the sciences, one thing I didn't really talk about, but if you're looking at going to nursing school, there are a ton of scholarships out there. There's federal scholarships. Johnson & Johnson is a huge organization that has scholarships. And because I knew I was going to be a nurse when I went to school, and I graduated from a tiny school. My graduating class was 52, but there was like 3 nursing scholarships for our graduates, and I was the only one who had declared nursing as my major. So I got all 3 of them because I looked. If I hadn't found them, I wouldn't have applied and I wouldn't have gotten them. But that's a big thing too, is looking to see what's available for scholarships is really helpful as well.
Thank you, especially for the mention of scholarships, because I feel like a lot of people won't pursue the thing they really want to because of the money it might take to go for the school.
It's a big barrier, and I understand that. And I actually, to get my master's, I did a federal grant where they paid for my master's if I taught, because there's a shortage of nursing faculty, because you can make a lot more in the hospital or working as a nurse practitioner than you can teaching. And so there's a shortage of nursing faculty, which means we can't accept enough people into the program. So it can be hard and challenging to get into a nursing program. So it's a federal grant that they paid for my master's if I taught for 4 years in a nursing school. So things like that are available for school as well.
Thank you. And this next question ties into our last one. What is some special training required for a nurse practitioner beyond med school?
Mm-hmm. Yeah, so you do, as part of nursing, both for my bachelor's and my master's, and I didn't talk about that, but was clinical time. So my last year of nursing school to get my bachelor's, I was in the hospital and I was taking care of patients, and I was working with nurses to learn how to be a nurse taking care of patients. And then in my master's program, I did the same thing. So I did 500 hours, and that was part of my education, working with a nurse practitioner and applying all the book work I'd applied to taking care of patients. And so you get that practical experience during school. Once I graduated, I had to take boards, and I didn't mention that. There's boards for nursing, boards as an RN, and boards as a family nurse practitioner. So I took boards, and there's a lot of board review courses you can take. So I took that, graduated from boards, and then a lot of places where you work will do kind of an orientation process or a mentoring process. So you're brand new, right? You've learned all the book stuff, but you don't have as much of that experience. And so finding someone who can mentor you and help you develop as a nurse or a nurse practitioner is huge in that. So I was able to work with a physician who really sought to mentor me and help me grow. And I could always ask questions, and I still ask questions. Yesterday, we talked about a patient that was a little more challenging, and just discussing with colleagues. So finding colleagues that you can trust and respect and talk to is really valuable as you grow in the profession.
Okay, thank you so much. I think that was our last question. Okay. Thanks for really giving in-depth responses to our question. I think Tia is going to finish us off, and also I'm going to send a feedback form for our attendees.
Great. Yeah, thank you so much. Your presentation was really engaging and really informative. I definitely learned a lot. And yeah, thank you for speaking with us today.
Sure.
Yeah, and we put the form down below, and if you guys can just fill that out. And yeah, so thank you for attending, and we can't wait to see what you guys do.
All right. Thanks, everybody. I hope you have a good day.
Thank you so much.
All right.